Welcome to Sightlines. I'm Dr. Hunter Cherwick, Vice President of Clinical Services at Orbis International. This episode will be a little bit different than our usual format. That's because I've invited my good friend Bulgan Orgilsaikhan to be my co-host, and I'm thrilled to say that she has agreed. Bulgan is actually a former patient who had a surgery on her eyes during an Orbis program in Mongolia when she was a little girl. Now she supports and volunteers with Orbis in a number of ways, including serving on the board of Orbis Canada. Bulgan, thank you for joining us. Maybe you could tell us a little bit about where you are in the world right now during COVID and a little bit about your journey with Orbis.
Thank you, Hunter, for being your co-host. It's my pleasure. I'm actually currently in Canada and working in a technology company right now. To tell you a little bit about my involvement with Orbis is that I was a patient when I was young. That's about 20 years ago. And I was very lucky to get a treatment with Orbis. So it just happened that I was able to and introduced back to Orbis in 2014, where I started volunteering. And right now I'm sitting with you here as your co-host and being an Orbis ambassador. So it's been a really, really interesting ride, and I hope to see more of it.
Yeah, and I mean, you were born in one of my favorite countries on earth. Mongolia, for those who don't know, is a landlocked country with Russia and China kind of on both sides of it. It's one of the coldest places on earth, but it's also one of the most beautiful. The summers there have the bluest sky and the greenest grasses. And if you're into horseback riding, it's one of the most beautiful places. I love fly fishing, and it has some of the largest salmonoid species in the world. So I really want to thank you for joining me today. We're going to have a great conversation today with Dr. Carlos Solarte. Dr. Carlos Solarte is an ophthalmologist from Colombia. He was actually at one time in his career an air traffic control tower person who used to help planes land. He is now a pediatric ophthalmologist in Canada. He works very much with our CyberSight program.
I actually met Dr. Carlos last year in Toronto for the Flying Eye Hospital Goodwill Tour. But if Dr. Carlos if you could just tell us a little bit more about your background, your role, and your involvement with Orbis.
Well, thank you so much. Yes, fortunately, I'm very pleased to be here. I have been Orbis is an organization that I have really close to myself and my family. I'm a pediatric ophthalmologist. I work full-time at the University of Alberta. I'm also an assistant professor. I am the program director for ophthalmology, and I'm involved with teaching from 6-7 years ago here in Edmonton.
And could you tell us what it's like during this difficult time, how the whole COVID situation has been impacting your practice and in general, how you've been coping with it?
Well, yeah, this has been very difficult. As the world came to a stop, we are starting to see the huge backlog of cases of those patients that came to a standstill. That is complicated because now we don't have the capacity or the space if we want to continue with the physical distancing rules that we have been doing in order to see all these people and go back and try to catch up with the backlog. That has affected all the spheres in medicine, not only ophthalmology, but I will say every single sphere in medicine.
I was actually in touch with the local doctors back home in Mongolia, and they were saying how they needed to prioritize certain surgeries just because of the supplies available, the limited supplies, because of the whole supply chain is provide difficult for medical operations to continue, and they had to prioritize all these surgeries. But then there's certain surgeries can only wait for so long. For example, congenital cataract surgeries or the ROP surgeries that have a very small window of getting that help needed.
So that is an incredibly difficult situation, Bulgan, because when those patients, specifically the oncology, let's talk a little bit about the oncology first. Mm-hmm. In my world, in pediatric ophthalmology, retinoblastoma is there. Yes, retinoblastoma, fortunately, the numbers of new retinoblastoma cases are not high, but it's still one patient is too many. And we need to be sure that these people get, or these kids get the prompt attention. Fortunately, Canadian government have determined the oncology as one of those emergencies and must be done despite the coronavirus. So we need to be sure that they have access.
And so we just heard the word retinoblastoma. And let's just take a minute to talk about what is retinoblastoma. Retinoblastoma is actually a cancer in the back of the eye of children. Retinoblastoma is one of the top 10 solid tumor cancers in children, where the back of the eye, the retina, very early on in a child's life, develops a tumor.
We need to prioritize, we need to triage the patients. Now, which ones go first, which ones go second? That is an incredibly difficult decision, because in my world, I would like to see all of them right away. But we can't, because we don't have the supplies, number one. Although we have supplies, they are not in the abundance or in the numbers that we had before, because also the factories to produce them, they are also in a backlog, because they also had to stop in order to protect their own employees.
Well, Bulgan just talked about the importance of how COVID is affecting the supplies and the medical care in her home country of Mongolia. And that's because it's a landlocked country and it's extremely huge. It's a large landmass. And to get supplies in the country, they have to either come through China or through Korea. And those flights have been shut so that the COVID cases can be contained in her home country of Mongolia. And even once they get to the capital city of Ulaanbaatar, it is very hard to get those supplies out to some of the outer cities, which could be literally 20 hours away by car. So Mongolia is a very special country, but because of its special nature, being landlocked, such a huge landmass, it's very sensitive to supply chain disruptions, which are now the norm because of COVID.
This has been one of the biggest public emergencies I can imagine. I am an ophthalmologist. I'm an epidemiologist by training. I have a master's in public health. And I remember reading on the history of epidemics, reading about the Spanish flu in 1918. I never thought possible, and I never crossed my mind that I'll be living a worldwide lockdown, declared pandemics, in the way that I was reading in the textbooks. That never even crossed my mind that we were going to get to this point where we are right now.
Dr. Carlos, I was just wondering, what is the situation with patients coming to the hospital? Are they fearful? Are they feeling comfortable in coming back to the hospitals and getting the treatments that they need?
I am feeling personally a lot of changes in my clinics. Even I have sometimes 30 or 40 patients in a day. About 5 or 10 of these ones have decided to cancel or not to come just because of the fear of coronavirus. That's about 20% on a day. That is too high, because we are following people who may be sick. We're following post-ops from previous surgeries, or people who have been waiting for a long time to see us. And the fear is not letting them go in thinking that if they go close to the hospital, they're going to get sick. Well, it's not the case, because hospitals are taking adequate prevention. And I don't think this is exclusively happening to me. And I think this is happening everywhere in Canada or even in the world.
And obviously we are experiencing extraordinary times, and I know your hospital is doing a lot to protect its patients, especially the pediatric patients. That's having checkpoints before they come in the hospital, the social distancing with chairs separated in between the waiting rooms, only allowing one family member with the child during your eye exam, having the mask worn at all times, certainly cleaning the examination rooms in between patients. And the big thing is that, certainly we can only have one parent now going with their child into the examination room.
Now, all of this is being informed to the patient, and we provide the patient with all these advanced notifications.
So, Dr. Carlos, I wanted to actually ask you about pediatric blindness because I was a patient when I was really young, and pediatric blindness is something that's, in my experience, very, very important. I wanted to know how the whole COVID-19 situation is affecting pediatric blindness in Canada as well as throughout the world.
I personally call it that you are against the clock. This opportunity to treat successfully amblyopia or lazy eye, or to treat childhood blindness and prevent permanent and unrepairable blindness is time sensitive. Now, COVID-19 may affect this care that we are doing for children, and they don't have the proper diagnosis, and unfortunately, we're losing the time. And if before the resources to see pediatric patients were limited, with COVID-19, they're going to be even more limited. And it will be ideal to make proper diagnosis, proper treatments, get the proper glasses, and start patching or surgeries or whatever we need as soon as possible. Because unfortunately, if this time passes, that reversible blindness becomes permanent blindness. And that's something that we should work towards that. We should work together in order to get these people seen as soon as possible. And that requires effort from everyone and the different resources, either on telemedicine, either online, or either through whatever resource we have. But we cannot lose the momentum.
Yeah, I was actually speaking to a beneficiary of Orbis who had it's a 3-year-old child, but she had a congenital cataract. Mm-hmm. And a very short window of help she could get. And she had a surgery done when she was 1 month old. So I know that small window of time to get help is super, super important in changing a child's life and future.
Yeah, if we let's take it as an example what you just mentioned, the congenital cataracts. It is important, incredibly important, to diagnose and treat them in the first 3 months of life, 3 months only. And that's where the best success rate is. As the children grows, the success rate reduces. When we reach the 6 months of age, we can remove the cataract, but the vision is not going to be restored as it was when it was 3 months old. That gives you just an example of, in one disease, how time is so sensitive, how we should be able to get these appointments or these treatments in this very short window. And we need to use that window. It's incredibly important. So I guess this pandemic has shown us how adaptable we need to be. We need to be incredibly open-minded. Nothing is given for granted, and we need to work hard to get our goals and objectives and go wherever we want. But this pandemic has expanded our horizons, understanding that we can reach even further. We can use many tools that we maybe didn't use before. The tools are there, but only if our desire to learn is there.
Yeah, and thank you for that, Carlos. And certainly these challenging times are going to drive new thoughts, new innovation, and that's really what Orbis is all about. Taking innovation and adapting to a huge challenge like global blindness and finding new tools, whether it's CyberSight or the Flying Eye Hospital. While certainly COVID has disrupted everyone's 2020, I am really excited to see how Orbis comes out of this a stronger, more innovative organization. I want to thank you both, not only for all that you do for Orbis and our mission, but also your friendship. It's actually really fun getting to talk with you all. And as always, thank you for your time and what you do to help Orbis and our family.
Bulgan, thank you so much. It has been such a pleasure not only to talk to you, but to be here with Orbis, an organization that I really appreciate, an organization that I'm incredibly committed to continue working with.
That was Dr. Carlos Solarte helping us explore some of the challenges that the pandemic has presented in eye care. Next up, we're talking with two of our team members from Latin America, Carolyn Collantes and Elisa Urruchi, about how COVID-19 impacted the way we deliver eye care training in that region and how people are accessing eye health services.
Caroline and Elisa, very, very nice to have you on this episode of Sightlines. Can you tell us a little bit more about your background and how you've been introduced to Orbis?
My name is Elisa. I'm living in Lima, Peru. I'm one of the staff nurses of the Flying Eye Hospital. And the very first time I met Orbis was when in 2006, when I participated as a translator. It was for 2 weeks, and I never saw that these 2 weeks will change the direction and the perspective of my life. And after these 2 weeks, I immediately decided to send my CV. In August 2010, Orbis contacted me and sent me an email. And the email was saying, "Are you still interested to join Orbis?" And I say, "Yes, I am. I'm still interested." And my heart was beating very hard because it was my dream and still does.
What about you, Caroline?
Yes, first of all, I want to say thank you for being invited to participate on this podcast. I started working with Orbis as a consultant just this year in March. So now I've been focusing with the M&E team, the monitoring and evaluation team, and the Latin American and Caribbean team.
Can you tell us a little bit more about the acronym LAC, LAC, and the Orbis's work in Latin America, in Bolivia, in Guyana, especially in Peru?
Absolutely. So that's a phrase we sort of throw around a lot, like, oh, LAC programs, LAC projects. LAC stands for Latin American and the Caribbean. So it's just a quick, easy way to just refer to this big region. And although it's a big region, it's very diverse. It's easy to lump up all these countries and say LAC, oh, the LAC projects, but each project is very unique. Each country is very unique. And so Orbis has done an incredible job on targeting in and seeing what are the needs that these countries have, what are these specific needs, and how can Orbis come in and just be such a support to the population there. Right now, Orbis has 5 active projects in this LAC region. One of them is in Guyana. 2 of them are in Peru. There is one regional one between Peru and Chile, and there is another project in Bolivia. And they span over different topics from ROP, working with premature babies, working with DR patients, working in advocacy. There's a bunch of research components that different projects touch upon. So it's a diverse portfolio, a diverse number of projects. So in Bolivia, we are partnered with the National Institution of Ophthalmology, also referred to as INO. And the project there consists of training the next generation of Bolivian ophthalmologists. So what's been really great about Bolivia and how they've been able to sort of shift their focus is, although a lot of these trainings are in person, Orbis has been able to create a lot of these trainings into a remote setting. So it's been great to see sort of Orbis take that innovation and sort of shift gears a little bit on how to continue the training and how to still be such an asset to these residents that are trying to continue on with the training and continue on with the project. In Guyana, it's a little bit different. Guyana has a focus on DR, and what's really cool about Guyana is that this project sort of tags on a previous project that they had where they were establishing a screening program in the public health system. And so their partner down there is the GPHC hospital, which is the Georgetown Hospital. And so this year, not only did they establish this program, but now they're attaching this year an artificial intelligence to support the patient care through the screening and through the referral system. So that's been also really exciting to see how to add on this technology and this innovation to programming and projects in Latin America.
I think, one of the things I want all of our viewers to know is in Latin America, we really focus on the retina, the back of the eye, with diabetes. and also in premature infants, a disease called retinopathy of prematurity. This is the disease that actually made Stevie Wonder go blind. When the child is born prematurely, before 36 weeks of gestation, the back of the eye, the retina, has not been fully vascularized. As you can imagine, your eye is constantly taking pictures, and it needs a lot of energy to do that. So the blood vessels are trying to supply the energy, but they haven't fully developed if a child's born at 28 weeks or 29, 30 weeks. And so what the body does is start having abnormal changes to the retina. That gets worse if the child is put into a high oxygen incubator with no monitoring. So certainly we're doing a great job of having children surviving early labor or premature delivery that they did not survive 30, 40 years ago. The problems are without the right technologies and the right oxygen, the retina can go blind. And so we have to find the right balance of helping the lungs breathe and the eyes see. One of our longest partners in Latin America, who's on our website, who's a hero during COVID, is Dr. Luz Gordillo. She has been focusing her entire career on pediatric ophthalmology and eradicating this disease, retinopathy of prematurity. One of the ways she does that is checking the children very early after they've been born and every few weeks afterwards to make sure that those blood vessels in the retina are normal. If they're not, they may need laser treatments or they need a medicine injected into the back of the eye to prevent the child from going blind. If we do not screen and intervene during that critical time, that child could be blind for the next 60, 70, 80 years. And so this COVID crisis has really made the already existing crisis of retinopathy of prematurity even more dire in Peru. And if you go on the Orbis website, you'll actually see how Dr. Gordillo gets in her car in her PPE and she drives and she sees every child. Carolyn, I know you did a site visit of our work and have actually worked with Dr. Gordillo. Maybe you could talk a little bit about what you saw and some of the memories and the patients you took away.
I visited a few hospitals with her, and I love seeing just all the respect that the nurses, the doctors have for her. She truly is a hero in her line of work, and just watching her interact with the patients, with the moms, and the young babies, it was definitely a highlight, being in her shadow and just kind of trailing, behind her and touring some of the hospitals that she works in. Back at the Institute IDV, which stands for Institute Damos Visión, translated to Institute We Give Vision in English. I was able to meet some of the patients, some of the moms of the patients that had come back for a follow-up visit. And so one story sort of stands out a little bit to me as I reflect back on my time there. There was a mom who had come in with her 3 lovely daughters, and they were a set of triplets. So it was a very unique situation. The mom's name is Elisa, and she came from a town that was about 2 hours away from Lima. So that involved a significant travel time for her to come to Lima and have her babies screened and tested for ROP. And so Elisa was telling us a little bit about what had happened. And she was happy to mention that she has these 3 beautiful daughters because she has 3 sons at home previous to these 3 daughters. So she was happy that now she has this very balanced set in her house. So as I'm learning more about her daughters, learning about Elisa, she mentioned how this was an interesting case. You had 3 premature babies, and as they were screened, one baby was screened and was perfectly fine. The second baby was screened and had a mild case of ROP. And then the third baby was screened and had much significant ROP presence. So they had 3 different treatments. One of them didn't have a treatment. The second one had more of just follow up to make sure that everything was going to happen and everything was going to turn out okay. And the third baby did have to have an intervention through a laser treatment. And so it was wonderful to see this mom come back with her children and just be so happy and so excited that all three of them were doing well. They were happy. They were beautiful daughters. And just the immense amount of gratitude that she had. She came with her sister and I believe another family member to help, because you can imagine so many babies to take care of. And they also traveled a long distance. This is an example of a family that had to come from, over 2 hours away from the capital to have access to eye healthcare. And so it was just a beautiful kind of like full circle story that we got to capture at the very end, and getting to meet her and getting to meet her beautiful daughters and seeing that everything turned out great and turned out as a super success story.
Yeah, wow. Thank you for sharing that story. I mean, I think when we talk about patients and the beneficiary stories, we oftentimes leave out that effort from the parent, or that children who bring their fathers and mothers to have care, or for that mother leaving off everything just so that the child can have a care. I think that is a massive effort. It's just they're leaving up everything.
Dr. Gordillo and the work she's been doing now is just a perfect example of what we're fighting for during COVID is, the helping children and intervening before they go blind for the rest of their lives.
So what are your concerns of this pandemic is affecting sight-saving work in Peru and the Latin American region?
First of all, I will say that fear is affecting a lot, because the population, they don't want to go to hospitals because they are afraid to be infected. And the professionals, especially ophthalmologists and nurses in the ophthalmic area that are working in general hospitals, they are sent to cover COVID services. And then some of them, they decided to quit. Ophthalmologists as well, some ophthalmologists as well that are ophthalmologists and nurses that are part of the risk factor, and they are not attending patients, because ophthalmology has to be very close to the patient. From the patient point of view, I would say, especially in Peru, 70% of the population is have informal jobs. So right now, that means that a person that doesn't work one day don't eat that day. And I think they will need to prioritize their needs, and probably will be more focused in food, home, education, and maybe some diseases will be left behind until it gets worse, and maybe it will be too late for them to address that cases. I will say as well consumables. In Latin America, most of the consumables that we use in ophthalmology to diagnose and to treat patients are are imported. And due to the borders that are closed, these consumables are getting more expensive, and are not available sometimes. And I would say as well, human resources. There are nurses infected, nurses and doctors infected, and they have been in intensive care units, and some of them pass away.
There were a number of nurses, different doctors that have passed away. So it's a really big tragedy and a deep loss for Peru. And another factor that just made this even much more complicated for people to get access to any sort of care, especially eye care, is just some of the distances that people have to travel to get to a local clinic or to get to a hospital. And when the country was shut down for months, there was no local transportation. There were no buses, there were no taxis. You couldn't be on the road. Even if you had your own private car or managed to find transportation, there was no way for you to receive any sort of routine follow-up or checkups or any of that. The only way that you were getting to a hospital if it was an emergency situation, if your life was on the line. So I think what we're going to see in the next few months is that there's going to be many people that haven't had the chance to receive eye care services, and that will then need to be attended to, right? And so Peru is going to have this other challenge of how do we open up again our services? How do we open up our primary care centers, our hospitals? How do we make sure we have enough resources to help these people that need to come in for routine eye care and other routine health checkups? So that'll be a challenge coming up for them as well.
I was having a communication with IRO, the regional institution in Trujillo. They are worried about the kids because they are not doing any visual acuity for kids. And now the kids that kids are at home using electronic devices, and the myopia is going to increase in these cases, and they are not going to be. This problem is not going to be solved until the health emergency is over. And many patients especially patients with chronic diseases, like glaucoma, macular degeneration, they are not continuing with their treatment. And there is a possibility that they will be worse, and maybe they will become, it's a risk of losing their sight. So the numbers of blindness and impaired people will increase during the following years, and something we have to work harder on that.
Why vision is so important in a country like Peru. We talked about it a little bit before, where about 70% of the population is in the informal economy, meaning they kind of live on what they make day by day. So if their livelihoods depends on them going out every day and working in the tourism sector, working in the transportation sector, in the commerce sector, their health is their livelihood. And it goes back to them being able to take care of themselves, take care of their family. And there's this just extension of a network that you have where you have maybe one person supporting many people. So just to tie in another reason why specifically in Peru, having access to healthcare, eye healthcare is just so essential.
Carolyn, thank you so much. I do think people sometimes don't recognize that sight is directly related to education, it's related to equity, it's related to economics, both macroeconomics and, as you said, the family economics. That was Elisa Urruchi and Carolyn Collantes. Dr. Marie-Josée Aubin is an associate professor of ophthalmology at the University of Montreal Faculty of Medicine. We're absolutely thrilled to welcome her to Sightlines.
I'm thrilled to be here. I regret we cannot do this in person, but really I'm glad you invited me to participate in this discussion.
And where are you at the moment, Dr. Aubin?
Well, I'm in Montreal in Canada. This is my hometown, and this is where I work. I work at the University of Montreal. I work as a surgeon, a physician. I'm an ophthalmologist, so I'm working with patients, and my specialty field is uveitis, which is the infectious and inflammatory diseases of the eye.
And tell us a little bit about your subspecialty. For those of us who don't know, what is uveitis? And tell us some examples of the type of patients you see or the type of diseases that it could be associated with.
Uveitis, I mentioned, is inflammation of the inner part of the eye. So the itis is inflammation, and uvea is the Latin word or the Greek word for grape. Actually, it's all the vascular part of the eye. So when the eye is inflamed, it can be inflammation due to infection, or it can be inflammation due to other inflammatory diseases, such as sarcoidosis or rheumatic diseases. But in terms of infectious diseases, I see ocular tuberculosis, I see ocular syphilis. There's been a great resurgence in Canada since the early 2000s of cases. In 1998, there was only 3 cases reported, and now there's like thousands. So I used to teach syphilis as, like an old disease. And now we see really, you have to teach students to think of syphilis always in their differential diagnosis. And we see a resurgence of other sexually transmitted infections, such as chlamydia. It's a different serovar than the chlamydia giving trachoma. It's the sexual transmitted disease, but it can lead also to chronic conjunctivitis.
I can tell you as an ophthalmologist, the uveitis specialists are the people who are kind of like the Sherlock Holmes. You get some very unusual diseases. You're thinking of very rare things. You have to think about the whole body. Like you said, someone can have tuberculosis in their lungs, but the first time they really manifest the disease can be in their eye. So I can tell you, I've referred many patients to your people like you, specialists in uveitis. And during the COVID lockdown, a lot of them can have their inflammation come back because they're not regularly seeing their doctors. So maybe you can just tell us a little bit about how COVID has impacted your practice and your patients.
Yes, certainly. It impacted tremendously. I think we could not foresee how disruptive this pandemic could be, and especially for caring for chronic diseases such as chronic uveitis. Because of the restrictions, there was delay in timely access to care and also access to medication. Like a lot of my patients, they're on immunosuppressive therapy. So we had to make, like special efforts with like sending reminder to all patients to, like keep taking your immunosuppressive treatment. You need them, otherwise the disease will recur. There was an impact also in terms of surgeries being delayed, all kinds of surgeries. Cataract surgery, you might think that in a country like Canada, it's not vision threatening, but yes, it is. And we do see patients almost blind by cataracts. So we went through all our list of cataract surgery, trying to expedite those that needed the surgery most. So it was a lot of planning to try to reach and give appointments and surgical care to the one that needed the most. There was a great fear for people to come in, and there's been great work from the direction of the hospital to make the environment as safe as possible with physical distancing. But all this brought me also to think of, to look into the impacts, the collateral impacts of COVID on the health, the vision health, the mental status of our ophthalmology patient suffering from chronic eye conditions such as glaucoma, age macular degeneration, retinal diabetes that need the treatment, as well as in chronic uveitis and the like. And also to look at the mental health and resilience of eye care professionals and trainees.
Most of our participants on this series have not talked about the importance of mental health, either during COVID or when patients have eye disease or a vision-threatening disease.
In terms of mental health, I've seen so many disruptive cases, not only with patients, like I see uveitis patients, and out of the blue, like some, 1 foot out of the doors, a young patient will tell me he has suicidal thoughts. I've seen that, at least twice since, like the last month. It's not something we're used to as ophthalmologists. And the same with the eye care professionals, nurses, trainees. I've seen situation where, like someone just come into my room and break into tears, like just from overwhelmed by, like all that's been asked for, because some of the professionals have been asked, like to work in COVID wards or being transferred from one, activity that they're comfortable with and to go provide care in intensive care units, for example. So it brought a lot of challenges and anxieties.
And that's one of the things I love about your subspecialty, because as a uveitis expert, you look at the whole person and the human being and the mental health of someone connected to that eye, because a lot of times they're dealing with a chronic disease or a systemic disease. And I think you're exactly right. I think COVID has stretched and really stressed everyone. And it's people like you that are able to help and comfort and provide compassion that is going to get us through this. So just a big thank you for that. I just wanted to take a minute and let people realize that you wear so many hats and you're treating so many varied diseases all around the world. But I think one thing that unites us with COVID is everyone has been stretched and everyone's been challenged during this year.
Yes, you're absolutely right. With the COVID pandemic, I think it highlighted a lot of the gaps in, like healthcare system delivery. Also, it shed lights on a lot of social inequities, maybe gender-based or racial inequities, and the realization that no one is safe until everyone is safe, and that the health, it means something to invest in health and health prevention in terms of economic wealth as well. I think those two key lessons may be like a step forward actually to push towards better health strategies for the future, for future pandemic or control of infectious diseases and neglected diseases.
I want to ask about your international blindness prevention, experience in countries like Nepal and in Africa. Can you tell us a little bit or share us a little bit about some of the stories with beneficiaries and how you saw people's lives being changed?
Yes, I think as a surgeon, like a cataract surgeon, probably the most rewarding cases of cataract I've operated were the one I did when I was doing outreach and surgical care in Nepal. We would operate more than 100 patients a day. We were like 2 or 3 surgeons operating. And it was amazing, like people bilaterally blind from cataract, and the next day they could see, and they with such a smile, and it was very rewarding, really, to see the good, like with the 10-15 minutes time operation, how much we could give to this gift of sight. It was inspiring.
No, I love that. And I'm sure it's got to be interesting, even during COVID, that you're able to do telemedicine to help patients around the world. You're doing consults and working with CyberSight in Haiti, or seeing your former residents in Kinshasa or the Democratic Republic of Congo. It's just amazing that even COVID hasn't slowed you down globally.
I would like to say that even during the COVID pandemic, I could pursue the activities in global eye care through the telemedicine network, and also through course modules that Orbis organized actually to give uveitis and other like subspecialty teaching for residents in French-speaking countries like Haiti. So I was very glad to be able to contribute to this.
I always try to look for the positive in things, and certainly we've had many days that all of us have had dark days during COVID. I have not talked to another human being face to face in 3 weeks. So all of my conversations have been on Zoom, and conversations like this and learning from people like you and listening to Bulgan, it makes it a little less lonely, right? And you can only imagine, and I've lived a very blessed life. I would just say you could imagine how isolating it must be to be in an isolated community geographically, to be blind, to be vulnerable, and during COVID where everyone is afraid to leave. And I think that's one of the reasons why we wanted this podcast series, was to get everyone connected, to give people good things to focus on, that, there's nothing more inspiring than giving someone their sight back. I think you talked about how the most meaningful surgeries you've done were the ones in Nepal. Helping those who need it most and giving the gift of sight is just miraculous. So, really, I just wanted to thank you for taking time today to connect with us. Certainly that's what Orbis is all about: connecting with patients, connecting with teachers, connecting with technology, and now, the techniques. And I'm sure you've been a better physician for your patients in Canada, having done all the work and trained all around the world because you've seen all different ideas and you've worked with experts who approach problems from different ways. So just thank you for sharing that expertise with us. I can't wait to get you back on CyberSight, and certainly I want to get you out in the field and on the Flying Eye Hospital. So again, just a big thank you from Orbis.
Thank you. Thank you so much.
That was Dr. Marie-Josée Aubin. I want to thank Dr. Aubin, Dr. Carlos Solarte, Carolyn Collantes, and Elisa Urruchi for joining us today. And, of course, a huge thank you to my special guest host, Bulgan. Thank you for joining me for Sightlines today. I hope you'll join us for the next episode and for the entire series. If you'd like to learn more about Orbis and the Flying Eye Hospital, please visit us at orbis.org. If you enjoyed this show, please subscribe to our YouTube channel to watch each episode and check out many other videos about our work around the globe. If you're listening to the podcast version of the show, please hit subscribe so you don't miss a future episode. And if you're listening in an Apple podcast, please consider rating or reviewing the show. It really does help others learn about us, about Orbis, and our sight-saving mission. Until next time,